Okay,
All righty.
great.
So, once again, thank you so much, Mark, for allowing Bonya Cares to present today for the Phoenix Public Library. Really appreciate this. And just want to say hi to our audience today. Even if it's small, it's still very important. Once again, my name is Ruth Esposito. In case you didn't have an introduction of me or my name wasn't mentioned previously, and just wanted to welcome you to our presentation. So I'm going to uh, turn myself off while we talk so I'm not distracting you at all from the slides, but I'll be back in to check in later on at the end when we're going to have questions.
Yes, please hold all questions to the end. Looks like we have someone else on with us, which is great. Okay.
Oh, great.
Sorry about that. Thanks, Ruth. Go ahead.
Oh, no. And thanks for mentioning that, Mark. Yes, we're going to save time at the end. Don't worry, everybody. We're going to save time at the end for you to ask questions. Also, invite you to share your own caregiving experiences. And as we move through our workshop, I'm going to be proposing questions to you that I want you to kind of think about. And then, if you'd like, towards at the end, you can respond at the session's end. In addition, I'll be using the term loved one, and that's going to refer to whomever you're caring for, be it your parent, a sibling, a friend, or a spouse, anyone really who's receiving care from you. So let's get started. I wanted to tell you that when I first became a caregiver for my aunt and my mother, I thought, okay, I'm a registered nurse and I can handle whatever comes my way, whatever's coming next. My caregiving journey actually started with a whole lot of improvising. As things got more complex, I learned very quickly that the key to caregiving long term is to be organized and prepared. So I'm wondering how many of you are currently caregivers and feel like you're figuring this out as you go along, as I did? If you're like me and most caregivers, you struggle to figure out what's most important. Today, we're going to cover the top 5 things that you should work on right away to make your caregiving journey much easier. So, you see here, we talk about organization and how that gives you peace of mind. Here's another question to keep in mind. How many places is your loved one's information stored right now? It's common for us to hear people say email, phone, tablet, laptop, discharge, excuse me, discharge paperwork from the hospital, insurance, EOB, even a business card from a social worker might come into play. And let's not forget that we keep so many things stored in our own heads. So, what is that? That's about 8 places already, right? Eight, that's a pretty lot. Now, think about this. Imagine that you have less than 5 minutes to provide critical information to a first responder team that has been called to assist your loved one. Can you quickly find your loved one's list of medications and allergies? How about the contact information for your loved one's endocrinologist or even PCP? And if you're not physically there, physically present, could the first responders easily find this information for your loved one? I hope this question that I'm asking you doesn't make you anxious. Maybe it does, but it's better to think about this now rather than later when you might be facing this situation in real life. So you can see where I'm going with this. Being organized and prepared is going to give you the peace of mind that you need in this marathon that we call caregiving. You're already doing the hard part. You're physically providing care for your loved one. So having mom's medication list or knowing her primary care doctor's name versus her specialist's name, excuse me, or making insurance information easy for everyone to find can go a long way to preventing your stress levels from really going through the roof. And I think we've all, kind of experienced some of these situations. So what we're going to go through is what's called the 5 foundations of caregiving. Caregiving starts to feel overwhelming when information lives everywhere and decisions aren't documented. The top 5 most important parts of caregiving are really like foundations. When one foundation weakens, your stress level can rise. When all 5 are stable, caregiving can feel much more manageable. Now let's dive into each of the 5 foundations. And don't worry about writing things down. I don't want you to write this down. We're going to go into this in detail. And then we're also, I think, Mark, we've already provided you uh, a checklist with the foundations as a worksheet that the participants can use in advance. And we'll be making sure that that gets emailed to you so that you can use that in the future.
Yep, I'll be emailing that out. Yes.
Great. Thank you so much. So we see Foundation 1 is medical snapshot. And this is really the backbone of your caregiving. Collecting these components will help you avoid feeling panicked. It'll prevent communicating information incorrectly. It'll make doctor visits much smoother. Having this information handy means that anyone could step in and locate critical information in just a couple minutes. If this information isn't recorded, every appointment and conversation might feel like you're starting from scratch. Let's talk through some examples. I'm sure you can think of some on your own. Say your mom's cardiologist changed her medication, but her neurologist didn't get the update. Wouldn't it be nice if you could easily share that new medication and the reason for the change with the neurologist? Or say your mom got a new doctor who wants to do a medication reconciliation. She's asking you for a full list of current medications. So you'll feel great and you'll feel confident knowing that you have that current list already prepared and updated. Now we're moving to Foundation 2, legal and financial documents. And this focuses a lot on power of attorney. Many caregivers say, I hope this doesn't come up. And then they may suffer silently in anxiety around legal and financial decisions. Please, please protect both yourself and your loved one against future crises by talking through having power of attorney put into place in advance before you actually need it. You can have POA or power of attorney from a healthcare or financial perspective, or both, as they are separate but equally important. And be sure to have the POA and advance directive documents stored and ready to share. So, for example, you'll be prepared, say, if a hospital asks, who has legal authority to make a healthcare decision on behalf of your loved one? A current advance directive will override, I should say, a new one. So remember that maybe you can't find your current advance directive for care. That's not a big problem. It's very easy to create a new one, and the new one will override anything that perhaps was created in the past, say 10 years ago, and no one can find it. And it's actually could be a good thing because it would be, much more updated. A legal POA example that's kind of important might be, say you're questioning a charge that isn't being paid, a bill that's not going to be paid, a claim from the insurance company, or you have a question on a bill. If you call the insurance company and you don't have legal permission to speak on your loved one's behalf, they won't be able to speak with you and they'll have to shut down the conversation. So it really is, just from the start, very important to have these things in place. This topic can be uncomfortable with loved ones, but having these discussions in advance and the documents ready to go is one of the greatest gifts that you can give not only yourself, but your loved one as well. Foundation 3, daily operations. Caregiving is really 1,000 tiny decisions. By writing down established routines, you can reduce what we call decision fatigue. There's no need to ask yourself every day, what do I have to do first? Take the time to write daily routines once, then you no longer need to spend any time planning the same things on the next day. Additionally, having written routines makes it easier to share caregiving responsibilities with family, friends, or even a paid professional caregiver who you may hire to come in. Maybe your sibling offered to help, but now your cell phone is blowing up all day because they don't know the timing of medications or whether the medication needs to be taken on a full stomach or without food. Writing details down means you can share the information and have someone else be able to step in to help you at even a moment's notice. Foundation 4 is backup and support network. One caregiver will often take on the lion's share of responsibilities because sometimes we think it's hard to coordinate tasks. Well, it is if everything lives in your head in particular. But if you organize caregiving responsibilities by writing them down, it makes the creation of a caregiving circle of family and friends possible. Also, having backup caregivers is really so important. Not only does having backup caregivers prevent you from burning out, it can mean that you can tend to your needs, go to your doctor's appointments, or even rest, say, for example, if you caught a cold. Whatever the case may be, having everything written out and shareable makes it easy for someone else to step in, either temporarily or for more than just a day at a time. There may be local providers that you may use for backup caregiving, such as respite care or paid professional caregiving agencies. It will be helpful to meet with the representatives from these types of agencies early on to discuss your loved one's needs, costs, or any other logistical details. And something else I wanted to mention is meeting caregivers in advance regarding cultural specifics. Someone had shared with me that their older father was very uncomfortable with a female caregiver who didn't speak their language. Um, Things that were, personal care, which can be maybe a little bit embarrassing, that sort of thing. So these are things to consider when you're looking for caregivers. And if you can do that in advance, you can have, everything that's making your loved one comfortable put into place. And it's not something that you have to kind of backtrack on and worry about later. Foundation 5, Caregiver Sustainability Plan. Also very, very important. We've all heard the saying that you can't pour from an empty cup, and that's absolutely true with caregiving. Caregiving is truly a marathon. You need to fill up so you can go another mile. And this isn't selfish, it's really survival, and it's smart. So remember, caregiver health is your health. It's part of the care plan for your loved one. Because if you fall apart, everything else risks falling apart as well. Share your daily routines with your sister. She can take care of dad for a few hours while you go to your own doctor's appointments. Share your daily routines with your brother. He can have lunch and quality time with mom while you go for a nice long walk around the park, getting fresh air and sunshine. You should and you can take these breaks if you've recorded all the details of caregiving in advance. Don't just have them live only in your head. So we wanted to talk about these resources for support. We want you to know that you're not alone. There are resources available when you need them. You may not need these today, but that's okay. I'm sharing this list with you so you'll know where to start when you need support in the future. You can search for local services by zip code on the Elder Care Locator. Aunt Bertha is another great zip code-based search tool for cost or low-cost community-based resources. Family Caregiving Alliance is a wonderful site where you can find different kinds of support groups based on what your needs are. The National Respite Locator is a service to locate respite services in your community available on the National Respite Network website. There's also a lot of educational resources by condition, so condition specific, and they're available on the Caregiver Action Network's website. And you can always do a Google search on local area agencies on aging. You just need to type in the city or the county, the name of those, and then area agency on aging. And you should be able to find a lot of resources there to help you. As I mentioned before, we'll be emailing, or Mark very kindly is facilitating emailing everyone a checklist of the 5 foundations we covered today. You can use it as a simple worksheet to start organizing things right away. Now, some caregivers build their own binders or systems. Others keep notes in different places and gradually bring everything together. After caring for my family members, I realized how much stress came from managing the information that I had in multiple areas. So Bonya Cares created one place to keep everything organized, including guidance in some areas where caregivers rarely see. It brings together everything we talked about today. So as a caregiver, you won't need to build a system from scratch. If this is something you're interested in, or if you'd like to explore later, we'll include that link when we'll help Mark with that when he sends out the checklist. But basically right now, and if Mark, if you can help facilitate, we'd like to open it up to our participants to see if they have any questions or concerns or experiences they want to share, or even just frustrations that they want to share with the group.
Sure, feel free to either type in the chat, or if you'd like to unmute, you can do that as well.
I'm going to leave the checklist, the group up here just for a few minutes so people have a chance to see it. No questions? Or
Not
hopefully that
seeing anything, no.
hopefully that's because the information was very clear.
Well, if it's helpful, I can share some of the questions that I've received before from other caregivers in workshops because sometimes questions that others ask we may not think of when, we're sort of put on the spot. So in case it's helpful for
Here. Can you do
if
it?
it's helpful for others,
Hello,
I think
somebody
the
unmuted? Did you have a question?
Should an attorney get? Yes, we were gonna type it.
oh, okay. I guess while we're waiting, I can definitely share, some of the questions that we've heard during other caregivers who have been a part of the workshop. So, a common question that we get, or it may not even be a question, but just sort of venting for a lot of caregivers, is the need for more emotional support. A lot of caregivers feel like they're doing everything alone and they don't feel like they're getting appropriate support from their siblings or their other family members. And it is common for a lot of caregivers to feel very isolated and alone and like they are carrying so much of all their responsibilities on their shoulders. So when we feel like that as caregivers, we tend to think, well, can't other family members see what I'm going through or friends notice what I'm going through and ask, what is it that I can do to help or why can't they just offer? But I don't know if this is going to sound surprising. A lot of people don't actually know until they are doing their caregiving, the primary caregiving. They don't realize how much is sitting on that caregiver's shoulders. So sometimes if caregivers feel like I'm not feeling supported, what I would recommend is that you come outright and ask, hey, do you think you can help me insert day and time and a small task? Because we might think it's just one small thing, but caregivers know one small thing actually is a million things, and that's one less thing that you can do. So that you have to manage. So for an example, it could be, do you think maybe on Wednesday night you could drop by and, bring dinner and have dinner with us? Because that would be a little bit of social engagement for you, also for your loved one. And also, now you don't have to plan for dinner. And it's just that one time and that one evening, but it makes it really easy to just ask for small things from people and ask if they can help with that.
I think that's a really good example, Nancy.
Mm-hmm.
There's a
Oh,
question
you
now in the
just,
chat. You're able to see that?
yeah. So the question is, how can you
Cool.
hire an attorney when you don't have money? And I think there's more, and it's get a maybe power of attorney. Am I assuming that correctly? Okay. Yes. So
Oh, okay, then,
Mhm.
then also, dear, I see commercials on TV saying that you can get supplemental insurance for a certain dollar amount if you're under the age of 85. Um, there's ways to get supplemental insurance even though your loved one already is suffering. Can you address how to get supplemental insurance?
every state has, and actually, it can boil down to even regions within counties and cities have different types of supplemental insurance that's available either through private insurers or through a government subsidy program. And I would just recommend speaking to a representative where they have that program being offered in your local area for more information. Because every program will be different and the requirements in order to qualify for those different kinds of supplemental programs are all different as well.
And how important is it to get an attorney that only deals with elder care insurance? How important is that? And now I know that sometimes the attorneys will actually turn on their client. I'm sorry, because I've worked in nursing homes and I've seen that happen. I apologize.
Oh, no, you don't have to apologize. So hiring an elder care attorney would be specific to setting up estate and power of attorney for healthcare and also for financial power of attorney. But a lot of it has to do with all of the financials that you want to set up and who's going to be the authorized decision makers. Um, you know, if you um, if you're talking about insurance, um, it, I just want to make sure I'm understanding correctly. If you're talking about enrolling for insurance, then the elder care attorney, I don't think that they are authorized or have enough information because they're not licensed to talk about a specific plan. So the best thing to do to talk about coverages would be to talk about the representative who is licensed and their licensure is managed by your state insurance commissioner. So they are authorized to speak about the insurance, not an elder care attorney.
Okay, and I know somebody, thank you for your understanding. Um, it
Is
was
that
this,
helpful?
may I ask just another real quick question?
Yes.
The the person that was involved, their spouse passed away and left significant debt. The person paid out of the estate money that they got. They paid off all the person's debt, finding out later that they should have consulted an attorney before they paid off their spouse's debt. And so it ended up with the person only got the residual of the estate, which was a couple antiques It was just very nasty. If you want to get into anything out of that, how significant the people went through an attorney, but the dirty situation occurred when the attorney said that the spouse was to only get the residual of the estate, and it was a nightmare.
Oh, that is, I'm very sorry to hear that. That's very surprising, that the
Not.
elder care attorney advised everybody to, or that family, the beneficiary, to pay out the debt from the estate. It's,
No, it was not the elder care attorney. It was the attorney that changed the deed to the house. The person was only one attorney, but it was her wording that made it a nightmare.
oh, I see. I'm very sorry to hear that. I'm sorry, I think I missed the question in part of that. Would
A
you?
person has to be very careful when their spouse passes away and there's debt owed. It was her husband's second marriage, and this was his debt. It was not her debt.
Mhm.
It's okay.
Well, yes, thank you for sharing that. Yeah, I feel like a lot of caregivers will wait until the last minute to start to get their affairs in order. And, it's always great to think ahead when it's not urgent, to start planning your estate and your beneficiaries and setting up your powers of attorney, as Ruth had mentioned. It's always a good idea just to have that bandwidth to address these things, especially with an elder care attorney or an estate attorney. That way, I I'm one of those people that asks, I'm sure I'm very annoying to everybody, but I ask a million questions because until I feel it's 100% clear to me, I feel like if I'm paying for that service, I am entitled to be educated and understood, in terms of my intention and what I would like carried out and how I would like to have it carried out. And asking those questions is something that I have a right to as I'm paying for that service. So, I always urge caregivers to try to plan everything in advance so that you have that time and that wiggle room so that you can ask those questions. But thank you for sharing that.
God bless. Thank you so much.
Sure. In terms of the question in the chat about hiring an attorney, if you don't have the funds for an attorney, the first thing that I mentioned to many caregivers who are oftentimes working professionals is to check with their employer's benefits to see if there are legal plans that are available. And sometimes the caregiving employee or the caregiving the caregiver who is employed and has employee benefits will say something like, "Oh, I missed open enrollment, so I don't have that legal plan available." Your legal plan is always open for enrollment during every year's open enrollment. And there are some legal plans where you don't even have to wait for open enrollment. You can actually check with the legal plan to see if they have an evergreen enrollment period, which basically means you could sign up anytime you like. So you end up saving a lot of money when employers are offering the legal plan. You sign up, you work with an elder care attorney, you can go through their network and find them and go through that way. The nice thing about the majority of legal plans that are offered through employers these days is that although, let's just say that I, through my employer, have access to legal plans. Well, that also allows my mother to use the legal plans if I am enrolled as a legal plan member. So a lot of legal plans coverages are now extending to more than just the employee and their nuclear family. So I always urge caregivers, check with your employer first. It is extremely, extremely a great value to work with attorneys like that through an employer-sponsored legal plan. And if you cannot find or have access to employer legal plans such as that, then I would check with you can check Aunt Bertha. That's a great place to check because they will have low cost or no cost attorneys who may or may not be available in that particular zip code. Another one is looking for the local area agencies on aging because they may have some attorney groups or firms who do pro bono work for elder care and elder support. So it's always great to check locally in your zip code to see what's available.
Thank you, Nancy. Anything from anyone else? Comment, question? Okay. I will email out the checklist that we talked about. So look for that soon. And Nancy and Ruth, thank you so much for presenting tonight.
Well, thank you, Mark. Thank you again. And thanks everyone for joining and for engaging with us today. Really appreciate it.
Okay. Thank you both again. Good night, everybody.
Okay.
Take care.
Everyone have a good night.
Thank you.
Bye-bye.
Bye.
Bye-bye.